हेलो एवरीवन, आई एम डॉक्टर रितिका फ्रॉम पारस हॉस्पिटल पंचकुला एंड आज का जो हमारा टॉपिक है दैट इज़ लिवर एंड लिवर डिजीजेज. हाउ कैन वी प्रिवेंट, व्हाट आर द ट्रीटमेंट एंड व्हाट आर द सिम्टम्स. इसके लिए हमारे पास आज स्टूडियो में है डॉक्टर आकाश गंडोत्रा. ही इज कंसल्टेंट गैस्ट्रोएंटरोलॉजिस्ट एंड हेपेटोलॉजिस्ट एट पारस हॉस्पिटल पंचकुला. वी वेलकम यू सर. Thank you for coming today.
Thank you for having me.
Thank you, sir. So we'll start with, sir, what are the common liver diseases which you encounter in your daily routine OPD?
Most common liver diseases what we see in our OPD are fatty liver disease,
Okay.
cirrhosis of liver, drug-induced liver injury, and hepatocellular carcinoma to some extent.
Okay.
And out of them, most common is fatty liver disease, which we see day in and day out.
It is very common.
Yeah, you also know that any one member of your family would be having a fatty liver disease.
Whosoever will get it,
Yeah.
himself check, he'll
Yes,
have a
yes.
fat. So, sir, what are the early signs and symptoms wherein one should see that the now liver is involved and get
So
themselves
symptoms vary according to the disease. In a fatty liver disease at early stage, people would have early fatigue, thakan rehna, bhook na lagna, loss of appetite. Some patients have excessive weight gain, and some patients might feel heaviness in their upper abdomen and maybe heaviness after eating. So early satiety, loss of appetite, fatigue, these are some of the early symptoms. When the stage progresses in a fatty liver disease or the otherwise also in other diseases, so jaundice, आंखों में पीलिया का आना, पेट में पानी भर जाना, ascites, पैरों में सूजन, pedal edema, खून की उल्टी होना, vomiting, hematemesis, that is gastrointestinal bleeding. It can come via mouth hematemesis or it can come in the stools. And encephalopathy. These are some of the later stages. These are the signs which we see in later stages of the liver disease.
So, what should be the healthy lifestyle to have a healthy liver? Any modification in our diet or food habits? Because in market nowadays, a lot of things are being advertised that they can boost your health of your liver. So, is it actually true?
Yeah. So maintaining a good liver health, what you require is quit smoking,
Okay.
stop alcohol. If you are overweight, then start decreasing your weight.
Okay.
Other than that, in the healthy lifestyle, in your diet, what you can do is start eating clean. That means no processed foods. In the market nowadays, we have processed and we have ultra processed foods also.
Okay.
What we eat, like for example, whatever junk is available, like fries, burgers, hot dogs, these are all ultra processed foods. So many of the studies have shown that these ultra processed foods are linked to not even liver disease, but it can affect adversely your cardiac health, it can affect your gut,
Definitely.
it can affect other organs as well.
Right.
So you have to avoid these ultra processed and processed foods. You have to eat wholesome foods, for example, legumes, pulses, vegetables, salads,
Basically
fruits.
homemade food.
Home cooked food.
Right.
Avoid alcohol, smoking. And again, very important is the use of drugs, over-the-counter drugs. People nowadays don't consult their doctors, physicians, and they just go to a pharmacist, take
Right,
whatever
and
is
they take-
available,
yes,
and
yes.
and again comes in picture the Ayurvedic, homeopathic remedies, whatever people are using. So they are using it here and there, right and left, without knowing their side
Correct.
effects.
Right.
And because liver is the most important organ which metabolizes all these drugs, so it is at the
Risk.
yeah.
Correct.
So you have to avoid those things. So I think these would be the
So what about the drinks which are available in the market, which they actually advertise that they will improve your liver health?
so these drinks, I would suggest our audience, our patients, not to take any of these drinks.
Okay.
Why? Because most of these so-called energy drinks, they have high content of caffeine, but with caffeine they also have high content of sweeteners, some coloring agents, flavoring agents, which are again comes into the category of ultra processed foods.
Okay.
And they are not good for your liver. So I would suggest not to take them.
Avoid them, right?
Other than that, what you can take is black coffee or green tea.
Black coffee and green tea.
Yeah.
Okay.
That is good for your health.
Sir, next we would want to know, I think audience also want to know how much alcohol is a safe alcohol. What is the safe limit? And is it actually safe for the liver also, or it's just a myth that this quantity is a safe one?
So yes, recent studies have shown that there is no safe limit for alcohol.
No safe limit at all.
No
Okay.
amount of alcohol is safe for your liver. Not for your liver, other than the other organs of the body as well.
Yes.
So no alcohol.
This alcohol and smoking both.
Yes, it's a no-no.
Okay, it's a big no. Okay, so sir, next we will proceed to what are the recent tests which are one should undergo to check their liver, and how frequently people should go and get their liver checked.
Yeah, so the most common test what people can do to check their liver is liver function test, LFTs.
LFTs.
That includes your bilirubin, your liver enzymes, SGOT, SGPT. So
Right.
that would be a simple test. Other than that, if somebody is suffering from fatty liver, or if they are at the risk of having fatty liver, for example, if they're consuming alcohol, if they have a sedentary lifestyle, if they're overweight, if they are diabetic,
Okay.
so they can go for an ultrasound of the liver. Other than ultrasound of the liver, the next important test is fibroscan of the liver,
Okay.
which is available at Paris, and it is commonly done now to see how much fibrosis and how much fat your liver has.
Okay.
So for a normal human being who is not at the risk of a liver disease, they can go once a year for your LFTs. And those people who are at risk of having a liver disease, for example, who are diabetics, obese,
Right.
or some other risk factors, they can go for a 6 monthly LFT and ultrasound. People who are having liver disease, chronic liver disease, for example, viral hepatitis, cirrhotics patients, hepatocellular carcinomas, we usually advise them to go for their LFTs and ultrasound every 3 monthly, sometimes 1 monthly also, depending on what state of disease they are having.
So next we would like to know, sir, how does liver impact our daily mood and energy? Are they relatable? Is there anything?
Yeah, so there is something called a liver gut brain axis.
Okay.
So this gets disrupted in our liver diseases because this is all interconnected. ये सब connected होता है, our brain, our gut and our liver. This is all connected. So
Okay.
whenever you have a liver issue, आपको usually what people or patients have, they have gut issues also, and they have decreased mood also.
Okay.
So your sedentary lifestyle, your weight gain, again, this is
Everything
actually
is
a vicious
interconnected.
circle. Yeah, so it is all interconnected. आपका वेट गेन होएगा, वहाँ से फैटी लिवर होएगा, वहाँ से you will have your bowel symptoms,
feel low.
and again this all goes into your brain. That axis gets disrupted and you will feel anxiety, depression. This again comes in. In our chronic liver disease patient, जो हमारे cirrhotic patients होते हैं, उसमें usually what we see is hepatic encephalopathy. So ammonia gets produced in the body, which is usually excreted from the intestines, and it gets metabolized by liver. But जब उनका liver weak होता है, like cirrhotic patients में, so this ammonia is not excreted normally from the body, and it reaches to your brain. And वहाँ पे these patients can present with mood alterations, judgment errors.
Okay.
For example, while driving.
So it is severe. I
Yes,
think it
yes,
is very,
and
very
in
severe.
in very severe cases, they can even present in a coma state.
Oh my God. Okay.
Yeah.
So, sir, at last we would like to know what are the treatment modalities, and is it available easily in our nearby hospitals, and what are the advancements in the treatment?
Yeah, so most commonly, as I've already told you, मैंने बताया कि fatty liver is the most common disease.
Right.
Around 1/3 of the world population is suffering from fatty liver disease.
Okay.
उसके लिए आपको hospital जाने की ज़रूरत नहीं है in most of the cases. What you can do is for your home remedies, as I've already told you, decrease your weight, stop alcohol, no smoking, clean food. That way you can have your fatty liver in check. Those patients who require treatment, for example, those who are diabetics, those who are very obese, not able to control their weight, and those who are having cirrhosis, those people require treatment, and those patients should go to their nearby practitioner or a hepatologist or a gastroenterologist and have their liver checked by all these tests we have mentioned, like fibroscan, blood investigations and everything. And nowadays most of the centers are having these investigations easily available, and people can get them. For a simple fatty liver disease, we have many medications which are now available. For example, vitamin E, we have GLP analogs, we have many other drugs which are now coming up. We have anti-obesity drug which is now being introduced into the market in India. It will be coming soon. So that way it can decrease the weight for those patients who cannot decrease on their own with their lifestyle medications. And again, it affects your fatty liver. It will help in decreasing the fatty liver again. And other than that, cirrhosis patients जिनको ascites है, encephalopathy है, bleed हो रहा है, they definitely needs further evaluation, treatment, admission, and with long-term treatment, this can be treated. But it is very important to understand that there are some liver diseases which are not curable.
Okay.
For them, what we require is liver transplant. So
Yes.
sometimes they get into that stage जहाँ पे transplant is necessary. So at Paras Panchkula,
It is available.
yes, we are having liver transplant OPDs twice a month.
Right.
And we are conducting liver transplant at Paras Gurgaon. We are recruiting patients here. We are making get them checked, and we are preparing them for transplant basically.
Okay.
And there are some other treatment modalities. For example, there is transjugular intrahepatic portosystemic shunt. There is something called TIPS. In
Okay.
a short form, we call it TIPS. So उसमें क्या होता है, ये उन पेशेंट्स के लिए है those who have uncontrolled bleeding. जिनको अनकंट्रोल ब्लीडिंग हो रही है, एंड वी आर नॉट एबल टू टैकल देम विद एंडोस्कोपी एंड अदर मोडालिटीज़, उसमें भी इट इज़ यूज्ड इन दोज पेशेंट जहाँ पे उनका असाइटिस कंट्रोल नहीं हो रहा है, पेट में पानी भर रहा है, हम दवाइयों से वो कंट्रोल नहीं कर पा रहे हैं, वहाँ पे इट कैन बी यूज. बट माइंड यू, दिस इज़ अ ब्रिज टू ट्रांसप्लांट. दिस इज़ नॉट क्यूरेबल. द लिवर विल नॉट गेट क्योर्ड, but it can temporarily give relief to that patient. But ultimately the patient has to go for liver transplant. And nowadays liver transplant is available at most of the centers, not in Tri-City, but in New Delhi and other centers as well. It is a bit costly, but nowadays health facility is improving, and people are kind of affording it. So those who are suffering from chronic liver diseases should get themselves checked, and if they are eligible for transplant, should go for transplant.
Sir, what advice would you like to give to our patients who are suffering with chronic liver disease? Anyone advice wherein they can live healthy life?
Yes, so most of our chronic liver disease patients, those who are having jaundice, those who are having ascites, apart from this, what two important things which is commonly missed in the OPD are the muscle disorders and the bone disorders.
Okay.
So these patients are also having chronic. They are in a state of chronic catabolic state, where the protein gets breakdown. They lose muscle, which is in the medical terminology is called sarcopenia.
Okay.
So these patients have sarcopenia, muscle loss. Gradually they lose their muscle. And second is their bone health is also not good. So they lose calcium. There are some hormonal imbalances in these cirrhotic patients, which make their bones weak over time. So two important things what people can do or patients can do other than having medical advice is, one is aerobic or resistant training. जिनका performance status अच्छा है, those who are having their routine activities, they are not bed bound and they are moving around, जो अपना काम कर रहे हैं, OPD में आ रहे हैं, routinely दिखा रहे हैं. So they should incorporate some amount of physical exercise in their daily routine. Okay. Whether it's a brisk walk, whether it's a resistant training, skipping, yoga, anything. So this has to be added. That is one. This will preserve their muscle. And sarcopenia, treating sarcopenia has shown that liver disease improves over time when you preserve their muscle. Other than that, we have medications that can help them achieve that goal. But other than that, what people can do is they can incorporate these exercises in their daily lifestyle.
Daily routine.
And other than that, these patients are at a risk of fractures.
Okay.
So
because their bone density.
Yes, their bone density gets weakened, their calcium loss is there, their vitamin D is low, and there are multiple other factors. So that has to be kept in mind. That is the second important thing.
True. Sir, nowadays we have seen that the cancer patients are increasing, and we are getting lots of people in the OPDs who are suffering from the cancer. So what should be the treatment? What is the treatment, and how we can treat it and prevent it from getting even worse?
So liver cancer is actually the fourth leading cause of death in our cirrhotic patients. And most of these patients, those who have liver cancer, they are having underlying cirrhosis. Okay. So any of the patient who is having cirrhosis, उसके लिए liver cancer screening is very important. उसके लिए we have some tumor markers, we have repeat ultrasounds which we do every 6 monthly, and we have CT scans and MRIs to diagnose that. Now once the patient gets diagnosed with the liver cancer, there are lot of modalities which are now available. Okay. And it is not like the end of the life कि cancer हो गया तो अब कुछ नहीं हो सकता. So there are modalities. We have ablation modalities, जहाँ पे tumor cancer के cells को we ablate it. There are some other modalities where we put in a drug जिसको टेस और टेयर कहते हैं.
Okay.
There are chemotherapeutic drugs which are put inside the
Body.
inside the tumor cells जहाँ पे हैं liver के अंदर, वो specific site पे target करके, and we put that drug there and they can destroy the tumor cells. Again, we have oral chemotherapy. Now we have immunotherapy.
Okay.
We have immune checkpoint inhibitors. These are the first line treatment modalities nowadays. So many people, it is kind of costly, but many of the people are now affording it, and they have shown excellent results. So there is SBRT, which is radiation therapy. We can target that lesion, and radiologically we can take the tumor out. Again, if it is an early stage, surgery is one of the options which patient can opt for, and again transplant.
That is the last option.
Yes, so that depends on what stage of liver cancer patient is having, and these are the treatment options which we can offer to the patient having.
So what is
liver
the
cancer.
success rate, sir, if somebody is suffering from CA cancer? Then
So again, that depends on
The
what
stage.
stage of cirrhosis patient has, what stage of liver cancer patient has. If it's an early stage, surgery is an excellent modality.
okay,
Take out that part of the liver which is having cancer.
right.
Transplant are now having excellent results. More than 90% survival of 5-year survival of patients are having with our transplants. Even 10 years patient, we have patients, those who are living for more than 10 years after transplant, and they are doing excellent. And we have ablation modalities which can temporarily take care of the liver. But again, if the liver worsens, we again have the option of transplant. We have immunotherapy. These are having with these modalities, we are having excellent results, and we can prolong the life of the patient, and so that less suffering, their quality of life improves, and so these are the options.
So one
Yeah.
more question I would like to ask here is this liver transplant thing, it is age related also? I mean, the success rate is more in the in
Yes,
early
so
ages. and-
yes, so we do have a certain age limit for liver transplant.
Yes.
I'll be discussing only about the adult liver transplant,
Okay.
not the pediatric
Not the
liver
kids,
transplant.
yeah.
So there are two aspects of it. One is the recipient part, जो patient है जिसको liver चाहिए, and the one who is donating it. We'll be discussing about the live donor. मैं सिर्फ live donor transplant की बात करूँगा, disease donor की नहीं. So live donor transplant में somebody would be donating some part of the liver.
Yes.
So उसका जो एज लिमिट का क्राइटेरिया है एंड रेसिपिएंट का मोर और लेस इज सिमिलर. इट इज़ बिटवीन 18 to 65.
65, right.
सो अगर हेल्दी मेल या फीमेल है बिटवीन द एज ऑफ 18 to 65, दे कैन डोनेट देयर पार्ट ऑफ द लिवर. एंड अगेन पेशेंट अगर 65 से ऊपर की एज का है, हैविंग लिवर इश्यूज, रिक्वायर्स अ लिवर ट्रांसप्लांट, सो अगेन the success rate again goes down as the age
Age increases.
goes on, as the comorbidities come in. If somebody is having cancer, somebody is having diabetes uncontrolled, somebody is having some other kidney problems or other, so that again comes into the picture. But 18 to 65 के बीच में it is more than 90% survival rate for a 5-year post transplant thing.
So, sir, the donor, he could be anyone who is having the healthy liver, or he should be must be the member of the family only.
So what guidelines say is that it should be a first degree family donor. But sometimes it is not available.
not
So
getting
yes, the criteria can be expanded to a second degree donor. Now many of the hospitals, they are doing a swap transplant. So if somebody, कोई और patient है who requires kidney and उनके पास they don't have a donor,
Okay.
but they have somebody who can
Okay,
donate.
between the patients only.
Yes,
मतलब
yes,
both are
between two.
recipients,
Yeah,
so
yeah,
one
yeah.
is donating the kidney.
हाँ,
and
किसी को
one is
किडनी
liver.
चाहिए, किसी को लिवर चाहिए, but they are not having first
This is
degree
great, I
relatives,
think.
but उनका blood group same है, so they can swap it. But this is again under scrutiny, और ये सारा उसके लिए एक policy है पूरा that has to be followed, and with video counseling and everything, that can be done. If somebody is not having a compatible donor, फर्स्ट डिग्री रिलेटिव है बट उनका ब्लड ग्रुप सेम नहीं है, सो नाउ व्हाट वी कैन डू इज अ ABO इनकम्पैटिबल ट्रांसप्लांट ऑल्सो. तो अगर किसी का इफ समबडी इज बी पॉजिटिव बी नेगेटिव, अगर उनको बी चाहिए बट फैमिली में डोनर है विच इज़ फिटिंग द क्राइटेरिया, हेल्दी है, एज क्राइटेरिया फिट कर रहा है, बट बी नहीं है, ए है और ओ है और AB है, तो उनको हम एबीओ इनकम्पैटिबल ट्रांसप्लांट से भी हम ट्रांसप्लांट कर सकते हैं या
Okay.
तो उसके लिए हमें कुछ एक क्राइटेरिया फॉलो करना है, प्लाज्मा फेरेसिस करना है, कुछ ड्रग्स देने हैं टू डिक्रीज द इम्यूनोसप्रेशन एंड वी कैन डू द ट्रांसप्लांट.
Thank you so much, sir, for enlightening us on such a crucial topic, and I think it was a very, very informative session. Thank you so much for
Thank you.
coming
It was
here.
pleasure. Thank you. It was my.
I urge my viewers to follow the advice which Dr. Akash just has given us, and just take a long walk and think positive and eat healthy, no alcohol and no smoking as well. So if any of the symptoms which sir has explained just now, if you think that you are getting any sign and symptoms, please visit us at Paris Hospital, Panchkula. Thank you.